So I guess now, Kim, it's my turn. I'd like to introduce TheCIINDE.
Great.
So as I mentioned, I've worked with these ladies for a number of years, and I can say for a fact that TheCIINDE and the CHNA have a very close relationship in supporting Canadian nurses in many ways to explore holistic practice for their patients and for themselves. Founded in 2020, the Canadian Institute of Integrative Nursing Development and Education is an amazing vehicle and catalyst for the development and recognition of holistic nursing practice in Canada. And I have been very fortunate to have worked with and brainstormed with these three wise women. I'd like to introduce the founder of the TheCIINDE. Sorry, not enough coffee yet. I'd like to introduce the founder of TheCIINDE, Sherry Hole, and her co-founders, Janessa DeCoste and Kim Janessa. Together, they have been the driving force behind TheCIINDE. And I'll pass it over to you guys.
Thank you so much, Kate. And we are so excited to be here with the CHNA and to be able to bring this forward today, where we really get to dive in and focus a little bit more on holistic nurse coaching. So as Janessa is sharing her screen here, we can see as she's pulling up her presentation, we're going to be sharing a little bit more in this presentation about TheCIINDE, but also about the complementary modality of holistic nurse coaching and what that has meant in Canada. And we're really excited to bring you a number of speakers today throughout Canada who are utilizing holistic nurse coaching in a variety of ways, whether that be at the bedside or at their current place, their current workplace, and how that's enhanced their practice as a nurse, or if they're utilizing this in a setting such as an independent practice setting. So we're hoping to engage in rich conversation and discussion, and we're hoping that this inspires you and hopefully clarifies any questions that you may have about what holistic nurse coaching is and how it may benefit you in your personal life and in your professional life as a nurse. So we're excited to be diving into this today. And Sherry, myself, and Janessa created and prepared this presentation. However, we'll introduce us in just a minute here, but we did want to share a little bit about what TheCIINDE is for those who might be new to us or maybe you're not familiar with TheCIINDE. So TheCIINDE stands for the Canadian Institute of Integrative Nursing Development and Education, and we are an internationally accredited educational organization that provides continuing education for nurses who are looking to get credit hours for their continuing education. So we are able to serve nurses in Canada, but also we've had a lot of international nurses as well come and take our programs, which is really wonderful. So we at TheCIINDE are really about reviving that heart of nursing. We recognize that providing care, especially in the care as nurses, the environments that we're in right now, it does provide a high demand on our physical, mental, emotional, and spiritual resources. We are in a unique time in history, and although some of these issues that we're facing as nurses are not new, they're becoming more complex in a lot of ways. So really, in an overtaxed healthcare system, we know that nurses are reporting unhealthy stress levels and burnout at alarming rates. And the life and or job satisfaction or dissatisfaction is quite alarming as well. So this is from what we're hearing from nurses when they're calling us. We're hearing this from them directly. We're also seeing this in the statistics. So really, our mission here is we're dedicated to enhancing the health and well-being of nurses and their clients through holistic practices. And this is where we partner so well with CHNA. And our mission is to promote a holistic approach to care, starting with the nurse's well-being, which is really where we feel we are unique because we're looking at that nurse first. We aim to revive the essence of nursing by providing education. So as we mentioned, we provide a lot of educational resources. We also provide support and tools for positive impact through different free offerings that we provide to create community and connection. So we believe in respecting individual needs. We're very focused on cultural diversity and the mind, body, spirit, environment, connection, and care, really looking at that whole person. Our programs are also evidence-based, and they empower both the nurse and clients that we may end up serving in holistic approaches to care. So we really do envision a world where nurses honor nurses, we support one another, And we're advocates for adopting a lifestyle where self-care is a part of everything that we do. Really, we're looking at that self-care as a self-responsibility and for showing up for ourselves first. So as self-care agents and coaches, we're out there and we're role modeling in our places of employment, in our community, assisting others to achieve optimal health and well-being, whatever that may mean to them, while also preventing disease and illness. So really that health promotion and disease prevention model. So here with us today, your presenters will be myself. As Kate mentioned, I'm Kim Durkach. I am one of the co-founders of TheCIINDE and co-creators of the Comprehensive Holistic Nurse Coach, and Consultant Certificate Program. We also have Sherry here in the back, who is our founder and CEO. She has a little grandbaby that she is with right now, so she is here listening. And although she likely won't be presenting, she might come on here and there if she's able to throughout the day. So you'll see her pop in and out, but she is here. And then I'll pass it over to Janessa to introduce herself as well.
Oh, you did such a good job. You could have just did me too. I am Janessa DeCoste. So I am the other co-founder here at TheCIINDE and one of the lead instructors in our comprehensive program. It's so exciting to see so many of you here today and just to recognize so many faces and so many names that I've been chatting with via email or on the phone in these last few weeks. So super excited to be here as well, and just excited for you to learn more about nurse coaching.
All right. So before we get into, Janessa is going to describe in a few slides what a holistic nurse coach is, and we'll be diving into that a little bit more. I would love if you would be willing to put in the chat just a short sentence or a blip around what do you think a holistic nurse coach is? What comes to mind? And I know we have a lot of familiar faces and people here who have taken the program, but even if you can pop in the chat, just engage and let us know what you believe a holistic nurse coach is. And as those come in, I will read them. So we'll just give everyone a moment and contribute. And while we're waiting for that, Janessa, maybe we'll just even head over to the next slide and I can talk a little bit to that while people are writing before we get into.
Yeah, just say that you made merchants copies.
I think Sherry's, I can't see Sherry because I'm sharing my screen.
Yeah, I'll stable it to.
1 second.
I can't mute her.
No, it's okay. I'm actually, when I get home, oh, you are Dr. Cole.
I don't know if you can see it.
Yeah. It's me again.
Maybe we'll just mute everyone. 1 sec.
Yes.
Right. I just can't see who's talking.
Yeah, it looks like a baby. I could be his daddy. Oh, that I don't think. Yeah. Not at all. Okay.
So we have a few things in the chat.
I am sorry. I muted everyone. You're good now.
All right. So we have whole person healing, just not focused on one issue or disease. A nurse who partners with the client to co-create a plan to work with their health. A person who integrates comprehensive approach to care for themselves and care for other people. And a nursing professional to help walk alongside you or your journey back to wholeness. Those are really great answers and really, yeah. Holistic nurse coach provides a robust and total care for his, her patients, clients to him or herself. And then we have looking at the whole person. So that's emotional, spiritual, health first, healing, not just sick care. So these are really great answers. So thank you all for contributing. And if you want to continue to put it in the chat, that would be great. So another one is holistic equals finding balance and harmony of the individual. So we can see some common threads and themes around really looking at that whole person, meeting them where they're at, looking at how we can take care of ourselves as well. So this is a really important piece, as we just wanted to bring to your attention one of the resources that we've been diving into, which is the Nursing Retention Toolkit of Canada that the Government of Canada released, and it's entitled Improving the Working Lives of Nurses in Canada. So we have seen that over 75% of Canadian nurses respondents were classified as burnt out. And that's a very large number of nurses in Canada. And that's very concerning, right? So we are seeing that there is a crisis in our retention of nurses and in their job satisfaction, as we were mentioning before. And we really feel that holistic nursing and holistic nurse coaching, the approach, how we focus on the nurse first, is a really important key in being able to retain nurses and also to help them thrive in their careers versus just surviving. So this is something we're very passionate about. It is that reviving the heart of nursing, and it aligns really well with the nursing retention toolkit and the strategies that are outlined in this document. So for anyone who's interested in it, it is 75 pages long, so we're not going to go into a whole bunch of depth in it, but I did want to bring it to your attention because it really aligns with what we have been doing here at TheCIINDE, really aligns with some of the retention strategies that they've outlined here as well. So in our next slide, we'll start to go over some of the myths around holistic nurse coaching. And these are going to be a bit fun because there's lots of myths around holistic nurse coaching.
Thank you, Kim. So we have been compiling. So we always get these really interesting questions or really interesting concepts that come through, and people will often say to us, well, I think the biggest misconception around nurse coaching and holistic nurse coaching is that whole concept that, well, isn't nurse coaching just for nurses? And that's a huge misconception, and one that we like to dispel immediately and right away when someone does bring that to us. Kind of as a joke, one time when Kim and I and Sherry were all together, we were just creating off the cuff videos that we could post on social media, and Kim turned the camera on me and she's like, what is a holistic nurse coach, or isn't nurse coaching just for nurses? And we've linked the video here, and when you get the slides after today, you'll be able to go in and see that. And it's kind of a silly 30-second clip, but it's really that whole thing around nurse coaching isn't just for nurses. It's for basically anyone with a heartbeat. So it's for anyone out there. There's so many different ways that people can use nurse coaching and access nurse coaching. And so today, one of our goals is to really articulate and share that with you so that you can feel confident in knowing what is a nurse coach, how can I be a nurse coach, and even for the general public, sharing with them like the value of nurse coaching. So some of the other myths that we've come across, and we're not going to go too deeply into them because we can't wait to get to some of these presentations today, is one of them isn't holistic nurse coaching like just alternative or unscientific? It just relies on all those complementary practices that are out there. And the truth is that, it really does integrate evidence-based practices, blending conventional medicine with complementary approaches like mindfulness, nutrition, and stress management. And that's a very, very concise overview of it, but it really is founded in evidence and founded on research. So we have a whole bunch of textbooks that we refer to and things that we bring into our classes. And I think it's really important to acknowledge that and bring that forth. Which leads into the next misconception that holistic nurse coaching lacks the professional rigor of other nursing specialties. And this is 1000% false. I'm looking around here, but I think my textbook is over on my table, but we have textbooks that we go through, and this is where there's there's methodologies and there's different things that have been created solely around nurse coaching. It's not just something that someone threw together and said, here you go, have fun trying to figure it out. It's all in there, and it's really founded on science and research. Another misconception is that it's only about wellness and not healthcare. And the beauty of nurse coaching is that it does blend all of those things together. So it blends together wellness, healthcare, lifestyle. All of those things can be part of a holistic nurse coaching session or a holistic nurse coaching practice. And you'll see today in some of the speakers that are coming forward that there's just so many different avenues and different ways that people are approaching things. So you'll get a better handle on that as we go throughout the day. Another one is that holistic nurse coaches will do the work for you. So they're going to come in and help you fix things. They're going to come in and to say, this is what you need to do to turn things around. And that is 1000% false. And I know there's lots of our current cohort 8 students that are here today. and they'll tell you that it's that writing reflex as a nurse that we always want to help fix, and we always want to help people the best that we can. So sometimes when we step into that nurse coaching role, it really does a very interesting dynamic, because we're there to help support them and walk alongside them instead of helping to, give them the answers. It's still going to come up and they still may answer. And oftentimes we'll have to switch our hats around and put on maybe our nurse consulting hat or our general nursing hat, but we're not there to fix things. We're there to help support and facilitate and be those facilitators of healing. And then the final one, which we talked about in the beginning, is that, holistic nurse coaching is only for nurses. And, nurse coaching can be for anyone and everyone. And, the use of powerful questioning, and we'll get into a little bit more of what the definitions are here shortly, but nurse coaching really is for everyone. So hopefully that dispels some of the myths around coaching for you. And if there's any other myths that you've heard of, we'd love to see them in the chat or other things like that. So feel free to pop those in the chat as we go throughout the day. All right, so let's actually get into what is holistic nurse coaching. So holistic nurse coaching is an integrative approach to nursing that emphasizes not just treating symptoms, but addressing the whole person. So one of those, or more than one of those comments in the chat, speaking to what is a nurse coach or what is holistic nursing or nurse coaching, alluded to just that. So it's addressing the whole person by mind, body, spirit, environment. And at its core, it builds on that traditional foundation of nursing practice and making it really a complementary modality that enhances the care that nurses provide. And that was why we chose the title for the symposium as well, as we wanted to introduce it as the complementary modality of holistic nurse coaching, because it is that. It's there to enhance your nursing practice. It's there to make you see or make you pull that into what you already have as your foundation for a nurse, and you're building up your toolkit with that holistic nursing or holistic nurse coaching modality. In holistic nurse coaching, the nurse supports the clients in achieving optimal health by focusing on all aspects of their well-being, like we said, including emotional, environmental, mental, physical, spiritual, financial health. The nurse's role involves empowering individuals to make sustainable lifestyle changes that promote long-term health and wellness. The other thing that I wanted to highlight is that it really is that nurse first concept. So I've alluded to this a few times now, but it's really important to understand that as a holistic nurse coach, you're first and foremost a nurse. You're fully trained, licensed, and skilled in the art and science of nursing. However, what holistic nurse coaching does is it really builds on what you have. It builds on that foundation, and it brings it in as an additional tool or a complementary modality. And it helps you create deeper connections with your clients and helps you facilitate more personalized care. This tool enables nurses to help clients manage stress, prevent disease, and improve overall health through practices like mindfulness, stress reduction, and coaching. So it really is important to always remember that nurse first concept, and that nurse first concept extends to our self-care as well. So I always think that's really important as well. For healthcare providers, it's really important. It's helpful to see holistic nurse coaching as a complementary approach that can seamlessly fit into traditional medical care. One of the presentations today will talk a little bit more about what it looks like including nurse coaching into the traditional model and into team-based care. So, they're really important members of the team. And when we can help other providers see the value of that and how important it is in pulling nurse coaching into the team, it can be really a profound experience. And then it's also important for the general public to also understand that nurse coaching can be seen as the way to get more personalized and compassionate support along your healthcare journey. It's so often that we hear of clients and patients that go to see their family doctor and, time is so limited and they're told, here's the things you need to do. And then it's like, have fun, go on your way. But then it's like, what's next? What's the next best step? And this is where nurse coaching can really help augment that and really bring that into your care. So to sum all of this up, holistic nurse coaching is a really great way to transform healthcare into a more collaborative, patient or client-centered experience that really addresses the whole person, not just the illness or not just the thing that's going wrong. Do you want to do this one, Kim, or am I doing this one? I forget.
You were doing
Is it
that,
me?
but
Oh, sorry, I can keep going. Okay. So some of our key concepts are to develop a coaching partnership. So this is where you're doing this in tandem with your clients or your patients. So you're developing a partnership. So it's not just, I'm going to tell you what to do and this is what you're going to do. It's a lot of that powerful questioning, creating the environment and creating the container to have that partnership develop. Creating safe space is a really important, huge component of a holistic nurse coaching relationship. We like to call it the nurse coaching container. Being sensitive to client issues or trust and vulnerability as a basis for further exploration. So that includes self-discovery, action planning related to desired goals and outcomes. And this flows so beautifully into the nursing process and the nurse coaching process. We won't get into those today, but it is really important to know that one of the things that the nurse coaching is founded on is the nursing process, and the fact that we do actually follow that in each and every part, in each and every step of what we're doing in these sessions. We're really trying to build on clients' strengths rather than trying to fix the weaknesses. And we're co-creating processes that are built on collaboration, that allow for reflection and creativity and the emergence of healthy behaviors. So nurse coaching really does have that power to enhance health and well-being and hopefully stop the epidemic of illness, injury, and chronic disease. I know it's a lofty thing to say, but each and every one of us on here today and each and every one of you who are going through this are, we're taking those steps, we're trailblazing, and we're being those agents of change, like Kim mentioned before, and we're starting out on this journey and we're hoping to evoke change. So it's so nice to see. I think there's 51 people on here today. So that's 51 agents of change and 51 potential nurse coaches out there in the world. So that's exciting to see. All right, so this is the $1 million question. What can I do? Where can I work? What can I do as a holistic nurse coach? And, there's such a broad scope. So if you look at your nursing scope of practice, you'll see that, the possibilities are endless. If you were to actually look at your scope and standards and pick through it with a highlighter and just be like, okay, yes, I love that. I can do that. And it's something we encourage our students to do, is to really go through their scope of practice and be like, where do you fit in? What can you do as a holistic nurse coach so that you're within your scope of practice? And this is where we often will talk about other complementary modalities that you can pull in as well. And this is why we also really like to highlight the fact that becoming a nurse coach or training as a nurse coach is really training in a complementary modality that will enhance your nursing practice. And I know I keep saying it, and I'll continue to keep saying it because it's one of those soapboxes I like to get up on, is I really want you to remember that nurse first principle, that you're a nurse first, and nurse coaching is something you're bringing into your nursing practice. So like I said, there's so many things that you can do. You can support behavior change and health optimization. You can help clients manage chronic illness, stress management, mental wellness, preventative health coaching. So even if it's not something that's super immediate, maybe it's just that you want to do some proactive health coaching or nurse coaching. You can support holistic health. There's group coaching, workshops, retreats, end-of-life care, cannabis care, workplace wellness, and occupational health. Like really anything that you can imagine, we can help you navigate and figure out what that looks like as a nurse coaching role. And then there's so many different settings. So that extends to primary care settings, hospitals, at the bedside. Recently we had an organization in Nova Scotia put 50 students through our holistic program here, and have these nurses go out and use nurse coaching at the bedside, use nurse coaching within teams, and at the management level. So that was a pretty profound shift to see a health authority actually embodying that and pulling that forward. And I know some of the students are here today, so that's really exciting. Then there's also specialty clinics, community health and public health, home health, telehealth, virtual care, workplace and corporate wellness, private practice, so independent practice. That's one of those myths as well, that a lot of people think when I become a nurse coach, I can only go into independent practice. And that's a myth we'd like to dispel as well, because you can really practice in any clinical setting. And it doesn't even need to be something like I'm using this in a formal role. Maybe it's just the use of embodying nurse coaching principles and bringing that forth when you're going into a patient's room in the morning, or even how you're greeting people. So there's the sky what is it? The sky's the limit. The possibilities are endless. Are those right? Yeah. You can do so much with nurse coaching. So I think that's what I have for that slide. I'll hand this one over to you, Kim.
You bet. So we often get asked as well, so what's the difference between nurse coaching? What's the difference between that and counseling and consulting? And so we're just going to give you a brief summary here of some of the key differences. So as Janessa was mentioning, just with nurse coaching, it's very collaborative, it's client-centered, and the approach is that it often empowers the individual to identify and achieve their own health goals. So really kind of that key aspect of their own goals. So it focuses on health promotion, prevention, and often lifestyle changes. So the nurse coach is really acting as a facilitator, and they're guiding the client in exploring their health challenges, in setting goals, and developing action plans for moving forward. So they'll often maybe look at those strengths and capacity for self-healing. So the relationship is about guiding and partnering rather than providing advice or, say, a diagnosis or specific intervention, so to speak. So oftentimes the nurse coaching scope is it's fairly broad unless you're in a specialized area, but we're really looking at holistic approaches that consider the whole person. So we're looking at physical, emotional, spiritual, and environment, which we have mentioned. And it really, again, is really emphasizing that client's active participation in their care. So in counseling, we can look at some of the difference often being that counseling can often deal with specific mental health or emotional concerns that a client may have. So it may explore the past, looking at more of the past, maybe past traumas, maybe mental health conditions, or things that they are looking to look at. So counselors are really assessing, they may be diagnosing and treating mental health issues, and they're going to be probably offering therapeutic interventions and coping strategies and advice. So again, those are some of the differences there where they're going to be looking at offering that advice and maybe more of that intervention approach. So just kind of looking at those differences, and really the goal of counseling can be to help individuals manage their mental health concerns, emotional things that they want to explore, and life-changing by offering that professional guidance and strategy. So it's more guided. Whereas in coaching, we're really working with the client. We're having them identify what they would like to work on, and we allow them to lead and us to guide and partner with them. And then consulting, our consultants are often called upon in technical or professional advice. So again, in a consulting role, you may be providing advice, and this may be to someone within an organization that you're providing advice around based on your nursing knowledge. And they're really looking at that problem-solving aspect. And there are times where these do interchange and overlap, and that's why recently, in the last couple of years, we have also added a nurse consulting module to our core program, because we do feel like there's opportunities where nurses may have the experience to be able to utilize that consulting role. And so there may be some overlap. So we really wanted to give everyone the resources to be able to delineate what is the differences and when am I using what modality. Anything to add there, Janessa?
I think that's perfect. Thanks, Kim. I think you summed it up lovely.
All right.
So nurse coaching core values. So we did leave this slide in here. Typically, we would go into a lot more detail. We have a few different frameworks that we use. So we have, the 5 nurse coaching core values. We have the 6-step nurse coaching process, and then we have the 5 steps to, nurse coaching. So what we did today was we just wanted to leave in the nurse coaching core values, and we really wanted to highlight on nurse coach self-reflection, self-development, and self-care. And I know Kim's mentioned this, and Kim had talked a little bit about this in the beginning of the presentation as well, around self-development and just the value that that has as a foundation of learning nurse coaching. So we really do take the time to really unpack. So we talk about the philosophy, the theories, and the ethics, the who, what, and where of nurse coaching, but we also really want to dive in and put that nurse first, because it really is important to acknowledge and know that in order to be able to really embody being a holistic nurse or being a nurse coach, it's really important to know where you stand, to self-reflect, to engage in self-care, and to engage in self-development. And, you know, self-care could look so different for so many people, but when you can really articulate and highlight for yourself, what does that look like for you? It can be a really profound experience, and it will translate over into your nurse coaching practice. The other parts of this are the nurse coaching process, which we've talked about a little bit here, but we haven't gone into a lot of detail, but it does mimic the standard nursing process. And then we have nurse coach communication, therapeutic relationships, healing environments, and cultural care, all of which we speak of and we talk to within our core program. And then nurse coach education and research. So today you're doing a little bit of research as you're learning about nurse coaching, and you're going to hear some stories, and you're going to hear how people have created their nurse coaching practices, or how they've brought it into different settings, like the clinical setting, maybe a team setting, or as an agency. So there's so many things that we can pull these core values into, and you'll see over and over again that without even really blinking an eye, you're going to hear these core values reflected in many of the presentations today. So keep an ear out for those things.
All right. So we're just going to take a couple minutes now to just begin to explore how to become a holistic nurse coach and a little bit about our program that is offered through TheCIINDE. So currently in Canada, TheCIINDE is the only educational institute providing this type of training and education for nurses in Canada. So our signature program, which is the Comprehensive Holistic Nurse, Nurse Coach, and Consultant Certificate Program, is available. We offer it twice a year, and we do go into the foundations and principles around holistic nursing and then holistic nurse coaching and consulting. So it is technically like 3 certifications in one big program that is 10 months in length, and we'll go into some of the details around specifically the nurse coaching aspect. And we just wanted to share that this is available, and we're excited to share a little bit more about this program with you. So we do have people, as we mentioned, it is internationally accredited. So we do have people from Canada join us. We do have a Canadian lens. That's one of the things that we really wanted to bring forth, is having this program tailored to nurses in Canada as well, so that we can look at our unique healthcare system and talk about and explore how we can implement holistic nursing, nurse coaching into spaces within Canada. So that's something we're really excited about, and we are excited to be accredited by the Canadian Nurses Association for 135 credit continuing education hours. Along with Janessa will talk about ANCC, our other accreditation, here in the next slide.
Awesome. So I'm not going to go over this whole slide. It's very busy, but I will highlight the nurse coaching part. So within the program, students are responsible for completing 60 hours of nurse coaching. And the reason that we have it all laid out like this is that when students do take the program, they are then eligible to write board certification exams in the United States, which I'll go over on the next slide. But just to give you an idea of what you could expect to do in a holistic nurse coaching program, and this is pretty consistent across the board. They're going to be, depending on what program you take, you are going to work with some partners within the program. So we call them dyad partners. Typically in our program, we have 1 dyad partner, and then you're going to work with 9 clients pro bono. So that means those could be family, friends, friends of family, you know, friends off Facebook, wherever you can find those clients, and you're working with them free of charge. So you're going to either work with them in an individual basis, or we've introduced a group coaching basis where you're able to work with them in a group coaching capacity over a number of sessions. And then we have coaching collaboratives, or weave coaching into our classes by doing case studies or real life scenarios. We have something that we have started this year, and it sounds like it's going really well from feedback from our advisors, where we do advisor feedback sessions. So this is where you come and you meet with your advisor, and they're actually talking with you in real time when you're almost done your dyad coaching hours with your partner in the program. You're going through that, you're kind of talking through, like, you know, what did they see in your videos? What did they see in how you opened and closed the container? Are they noticing that you tend to go and fix things or tend to try to swoop in and fix rather than ask powerful questions as a coach. So those are really profound sessions, and they're done all together with your advisor and your partners. And then we also have a presenting yourself assignment where you're articulating what is a nurse coach, because we need to be able to articulate that to our regulatory bodies and just share with people like, this is what I'm doing. This is a complementary modality. I understand I'm a nurse first, but I'm weaving this new thing into my practice. So it's just a broad overview. You can also find that on our website, or you can reach out if you needed more information. And then I alluded to board certification. So graduates of our program obtain the credentials KIND Certified Holistic Nurse, Nurse Coach, and Consultant. And we give them this cute little logo here that they can put on their website, or they can put on their email signatures. But it is optional that you can go ahead and write for your board certification. And so board certification is through the American Holistic Nurses Credentialing Corporation, so AHNCC. And it's completely optional. So some choose to go on and do that. And we always encourage people to go and write for those board certifications because it really demonstrates a nurse's commitment to the highest standard of nurse coaching, validating their expertise and fostering credibility within the healthcare system. In Canada, where holistic nurse coaching is still emerging, certification through AHNCC can really help establish this modality as a respected and integral part of that broader healthcare landscape. And we're always a few steps behind the US, so we can always look to the US to see what are they doing, where are they at, and we have lots of connections with many of those organizations in the US. And we're always striving to encourage nurses to sit for board certifications, but it is a personal choice. So many members of our team, so Sherry, Kim, myself, either have our board certification in nurse coaching and or holistic nursing as well. So it's definitely a journey, and one that you get to determine if it's for you or not. So just wanted to share that a little bit. And I think, yeah, so we're almost at time here. We did pretty good. Thankfully, Kate didn't talk too long because we talked way too long. So if you're wondering how you can use holistic nurse coaching to create positive change in both your personal and professional lives, I think you're in the right place today. And we are going to walk you through this. You're going to hear stories from nurses who have really embraced holistic nurse coaching in a variety of ways. And if you haven't heard me speak enough, you're going to hear me next. So yay! And then I'll be quiet for the rest of the day. So I'm so excited to hand it back over to Kim.
Absolutely. So maybe we'll just take a 1-minute pause, and if